Ebola has killed more than 1,400 people across West Africa. There is no proven vaccine or cure for the disease and no end in sight for the epidemic. But Operation Blessing is bringing aid to help fight the outbreak.
My friend Moses here is modeling for us some of the supplies that Operation Blessing is sending in to help with the Ebola workers. This is a complete outer layer shell. It's disposable, and they change this daily as they're in the Ebola environment. They have to wear rubber gloves, and a face mask is essential. And that's just for the workers. The doctors that are face to face with the patients are having to wear even more protective layers. And Operation Blessing is shipping in all of the equipment they need, needles, medicines, this protective clothing to help serve the Ebola clinic in 2 locations in remote parts of the country.
In Operation Blessing, Vice President David Darg has just returned from the region, and he joins us now with more. Welcome, David.
Thanks, Mark.
Thanks for taking the time today. We appreciate it. What did you see? What are conditions like on the ground in Liberia?
Well, it's a nation in crisis. Really tough situation right now. The people of Liberia are afraid. There's just mass hysteria, mass fear. The government's warning people to stay at home if all possible, not even to shake hands with people on the street. And, through all the media and the stories they're hearing, people are very afraid, and they have a right to be so because Ebola continues to spread, people continue to die, and there's no end in sight yet. They're quarantining whole neighborhoods of the capital, Monrovia. And so there's a lot of concern and just a lot of work to be done over there right now.
And I'm just curious, I know you have great faith, you trust in God, but were you a little nervous going over there?
You have to admit, it was kind of troubling to go there. My wife certainly was afraid,
Yeah.
but we have enough experience at Operation Blessing working in around these situations to know where you go, where not to go, and how to stay safe. So it wasn't too dangerous for me.
All right. Well, why is this disease still spreading, and what kind of aid is Operation Blessing going to be providing?
Well, Ebola continues to spread because there is no cure. That's the number one reason. But the real reason why it's spreading so much is people really haven't been educated enough to know about the dangers, especially in the remote parts of the country. There's a lot of sort of a stigma against Ebola, which is causing people not to seek treatment if they feel the symptoms. So one of the things that Operation Blessing is doing is we have Ebola prevention teams. These are church volunteers that are going out into communities, handing out literature, warning people of the signs, telling people what to do if they have symptoms, providing soap and hygiene training. So we're trying to do everything we can towards prevention, but we're also helping with the treatment side. Operation Blessing has shipped in large amounts of medication to help support Ebola treatment centers in certain parts of the country. And we're about to start producing liquid chlorine, which is very useful for disinfection, for helping people to clean their hands. So we're doing everything we can to help right now.
I know many times Operation Blessing will partner with a local church. What role is the local church providing during this time?
Well, we have great local church partners there in the capital of Monrovia, and so it's church volunteers that are forming these Ebola prevention teams. So they're wearing T-shirts, going out into the communities, being the boots on the ground, really helping spread the message of prevention. But we're working with churches now also for chlorine distribution. So we're really utilizing the local church as much as possible.
Okay. Well, what are Operation Blessing's needs at this moment for our viewers who want to help?
Well, of course, prayer is so essential just to keep the team safe on the ground, but people can help financially. We're doing medical distribution still with the chlorine, with the prevention teams. Finances are a need right now, and we can do a lot to help Liberia, and people can join us in that by just making a donation to Operation Blessing.
Okay, so the 2 biggest needs right now, prayer, of course, and then finances.
Absolutely.
Okay, David Darg, Vice President of Operation Blessing. Thanks for your time, sir.
Thanks so much.